questions. Clare.
I feel like I've hijacked this meeting, coming in here doing ICO exams, but I hope that you'll find some of it useful. I'm also going to talk a little bit about fellowships as well, and we can also take questions on both at the end. So I'm going to move through quite quickly. Remember, the ICO exams are the only worldwide medical specialty exams. No other specialty has anything like this. And we do them in over 80 countries, and we have 125 centres. And so it makes it much better because you don't have to travel so far in order to do these examinations and to pass. We base it all on the ICO Residency Curriculum, and I can say have a look at it because it's very, very comprehensive, and you know what we're going to be testing you on. And we try to cover the curriculum as far as we can. Our exams are Criterion referenced, just a bit as was described before, that everybody could pass the exam or nobody could pass the exam. It just depends how difficult the exam is, where we put the pass mark. So there isn't a set pass mark, there isn't a set number of people who could pass or fail. We adjust it depending on how difficult or easy we think the exam is by doing standardization. We have all these exams, which I think you've already covered, but we advise, but we don't insist, that you sit them, usually the clinical ones, between years 2 and 4 of ophthalmology training. Advanced exam, you want really to have done at least 4 years of ophthalmology, and subspecialty, we do insist that you spent a year in that subspecialty. The fee structure, and it's interesting, that everybody has said it's expensive. Well, it's coming down. Price is coming down in India because we're changing from the GNP to World Bank, and you work out as being less on the World Bank, having to pay less on the World Bank than you do on the GNP. So it's about 10% cheaper this year than it was last year. And if you apply together, so if from one institution, you get it all together, it's obviously cheaper for us to administer the exams, and so we give a discount. And if it's the first time that somebody's run it in a certain centre, we give very big discounts just to sort of encourage you to do it. It's also cheaper if the Eye Society, as it is in India, is a member of the ICO. Not a license to practice. It is very fair. The efforts we go to about anti-cheating are phenomenal. We take photographs of where you're sitting in the room, and if you're next door to somebody and you've written exactly the same answer paper, we'll pick it up. And we'll pick up all sorts of cheating tendencies, and also if you take phone out and decide to copy the whole paper, that will be picked up because our invigilators are both at the front and the back of the hall, so you can't do fishy things like that. And if you pass the basic sciences, optics and refraction, you get exemption from doing them in Glasgow, and there's, as you were saying, that for FRCS Edinburgh, we are the written exams. And that we thought was friendly to candidates because you don't have to travel to one of 4 places that Edinburgh sits the exams, but you do have to travel for the face-to-face exam in order to get FRCS at the end. It's slightly complicated during the changeover times as to who gets what or who has to sit what in order to get FRCS or MRCS Edinburgh, but this is the first year that we are doing all the written exams for Edinburgh. You get a free assessment, formative assessment, when you apply for the exam, and you just apply to look at the formative assessment, and if your application has been accepted, then you get it, and you get it twice. You can sit the exam in October when you apply, and again in March, so that you can see that you're improving, because the exams are sat in April. We mark them. Standard examinations, well, there's a process for applying, and we will send you confirmation, a booking form, syllabus and a book list that we expect you to read. But it's interesting that our book list is much the same that was shown earlier. The basic visual sciences, we call them now, 120 questions. It's gone up this year because we wanted to just get the validity a little bit better. And they're single best answers MCQs. This is an example, and I think it possibly takes too long to read, but this is how it works out. Those who are really quick will have already worked out that 3 is the correct answer. For optics and refractions, there's now 80 questions, single best answer, 1.5 hours. Sorry, 60 questions. knew I wrote it right. And here's an example of one. So what's total internal reflection good for? It's good to use with a gonioscope. There we go. 200 questions, 4-hour paper, same scenario, but a lot of pictures. And so this is a typical picture. What's the first thing you would do in a patient who has bilateral dislocated lenses? Well, you just see if they can be happy with spectacles or contact lenses, because they might be quite happy with that. We translate into Chinese, French, Portuguese, and Spanish. Only thing I would say is that the Royal College of Physicians and Surgeons of Glasgow, but not Edinburgh, insist that you sat the exam in English. For Edinburgh now, you can sit it in another language. The FICO, 85 questions, extended matching, and this is typical of it, and I don't think we've time to really go through it, but this is a 62-year-old female who is in good health, a 3-year history of severe pain on the side of the patient's face, 5 to 8 times a day, and they last up to 20 seconds, and the symptoms are produced by a touch of a light breeze. So that's a typical extended matching question, but most of the questions are actually MCQs. This is a patient whose right fundus looks the same as the left fundus, having visual loss. What's the likely diagnosis? And I know you're all quick here, so we'll say it's birdshot rather than any of the other white spot conditions. If you pass the advanced exam, you're able to use FICO because some people, as we have the slide earlier, like to collect post-nominals. The subspecialty exams is where we have really been working very closely with the AIOS, and we offer them online. And all the subspecialty exams that are sat in India will use our written papers before you go on to do the clinical part of the subspecialty exam, which will be run by the AIOS. And we're running them in those 7 specialties and start cataract in October. Fellowships, which I think is the bit where people perk up usually. I asked why that should be, and I suppose it's obvious. You've got to pay to do exams, whereas you're offered something free if you do fellowships. No? Right, anyway. Fellows' experiences, why should you apply? Because you can get a fellowship. You can learn new techniques in diagnosis and treatment and surgery, and also how people do things. And 95% of people would recommend others to do fellowships. There are 3-month fellowships. There's a retinoblastoma fellowship, which is a 6-month fellowship. There are 6 awards a year for those, 60 to 80 awards for the 3-month fellowship. And for the 12-month fellowship, there's 5 awards a year. And this is the amount of money that you get for your flight and your upkeep, because the local people will have you in their department for free. And then there's the Allergan Award, which is 12 months, which is for people who are interested in research. Then there are, we've done 1,200 3-month fellows. 88 have been in those following countries, and 30 are in host countries in Europe, USA, and India are the 3 commonest areas that host them. So the fellows come from Asia, from India, from the Middle East, Sub-Saharan Africa, and they go to Europe, USA and India. And I must say the Indian departments that have taken the ICO fellows have been absolutely wonderful hosts and encourage people to operate. And these are the subspecialties, and I think it's difficult to see them all, but you'll see that VR is very popular. Pediatric is also popular, as is cornea and glaucoma. Oculoplastic, less so, and then the other ones are less important. In order to do an ICO fellowship, you're much, much, much better chance of being successful if you've done the ICO exams. And so 63% of the ICO fellowships have done the ICO basic exams, and then 60% have done optics and refraction. So your chance of getting a fellowship is much more likely if you've done the exams. But you can technically do it without having had the exams. There's the application, how you make the application. And can I encourage you all to come to the WOC, which next time in 2020 will be in Cape Town, and it'll be the first major ophthalmology meeting in Sub-Saharan Africa. And your present Professor Namrata said that promised that there would be 1,500 coming from India. So it would be very nice if we do have that.
Thank you
all very much.
Thank you so much, Dr.